Myths about the heart attack is that if you get a heart attack, you are going to die. With a good treatment, not more than 5 to 6% of people die of a heart attack. Artificial intelligence, which we talk about these days, is very important and has come into the field of cardiology also. The robotics have come into cardiology. The medical treatment by artificial intelligence, you can specially create a algorithm for the patient's treatment.
Hello and welcome. You're watching GK Podcasts and this is me, your host, Shireen Naman. Maulana Rumi has very well said, "Let yourself be filled with the passion of life." Today, to hear a passionate journey, we are in conversation with one of the India's most legendary medical minds, a pioneer in cardiology, whose work has saved countless lives and inspired generations. It's my honor today to introduce Padma Shri Dr. Upendra Kaul, a beacon in the field of cardiology. Sir, it's my pleasure to have you here today.
Thank you, Shireen.
Sir, very briefly, if I start, can you please tell us something about your evolving journey in the field of cardiology? Because you obviously have an extensive field of experience in the same.
Well, my cardiology career started, if you call the training as a cardiologist is a part of it. It started way back in 1975. That is when I did my MD medicine, and following that, and that was a time when very few people would study further. Because for what for? And these courses like DM cardiology had just started. Maybe 1 or 2% had done DM before that. So it was a kind of a debate in my mind. Should I join it or should I, get into medical college, become a lecturer? I was never interested in private practice as a whole, this thing. So I always had a little academic bent of mind. So finally, Dr. Padmavati, she is a very well-known cardiologist. She is no more now. We lost her about a couple of years back, and she had an eye on me. And she thought that, this boy should not be left alone. So she blessed me and
she found a
spark in me, and that's how I started the career of cardiology. And I was always interested in the matters of heart, the literary heart or the organ heart. And I joined it and I enjoyed my studies, training, and I have worked in the first coronary care unit of the whole country. There was no concept of coronary care units that time. You have these days coronary care units in every hospital, even in small nursing homes. But I joined and we made a coronary care unit, a 6-bedded coronary care unit, and saw many important patients. One of the first patients I saw and treated was D.P. Dhar. D.P. Dhar, very well-known Kashmiri politician.
The DPS school.
The school is in his name. His son is Vijay Dhar. So from there, I never looked back. And once I became a cardiologist, my other passion was to come and work in Kashmir. Although I studied in Delhi, because my father had gone to Delhi in 48. I was born and then brought up in Delhi. Although born in Srinagar, but taken to Delhi in 1950. And after I finished my DM cardiology in 78, that was the time when Sher-e-Kashmir Institute was being built. So I thought that let me try my best
to get in.
So I took an appointment from Sher-e-Kashmir, Sheikh Mohammed Abdullah's private secretary. For that also I had to, pull strings. And finally got an appointment. He was walking in the corridor and spent a few minutes with me. Somehow, he didn't even ask for the CV. He said, "Baba, ye tik dana asne tat laga. Jahan ki tumko dana pani hai, wahan lagoge." So that disappointed me a little bit, but I went to PGI Chandigarh and I got an assistant professor job there. And there I saw Kashmiri students being trained in cardiology, and I became their teacher. And the first head of department of cardiology of Kashmir Institute was Dr. Bashir Ahmed Wani.
Okay.
So he became my student, and so the relationship started from there. And his wife, who became the dean later, she was in clinical pharmacology.
Okay.
So after that, I became a cardiologist. Finally, I joined All India Institute of Medical Sciences and developed many new techniques. The angioplasty and stenting, which is done so frequently these days, was started by me in this country way back in 1980. And a lot of trainees used to come, and then my relations with SKIMS also grew. I came here. I trained the people in SKIMS for complex angioplasties and came here, gave a Sher Kashmir oration once here. So life has been good, and I
Initial journey, yes.
have been doing all aspects of cardiology.
All right. So now switching to your cardiology field, we have been seeing a lot of rise in heart attack cases in Kashmir these days. What, according to you, is the prime reason for that? Do you think that lifestyle changes is a main cause? Because we have currently, winter season is also ongoing. What's your take on that?
Yeah, lifestyle change, adverse lifestyle change, bad lifestyle is one of the very important components of inviting a heart attack or for that a stroke. Because bad lifestyle means lack of exercise, eating wrong kinds of fast foods.
We've got a sedentary lifestyle.
Sedentary habits, lot of stress, urbanization. All of us, I come from a village, now living in a city. So a lot of people for various reasons have to move to cities. Exercise becomes less, stress becomes more. All this leads to high blood pressure, diabetes, and if you have hypertension or high blood pressure, diabetes, your cholesterol levels, bad cholesterol goes high, good cholesterol becomes low. So these are the risk factors which are very important risk factors for getting a heart attack. Besides that, pollution, smoking has not reduced, people keep on smoking, and obesity because of sedentary lifestyle, that again is a major problem. So all these 6 or 7 risk factors, which are basically lifestyle diseases, combine together to give rise to heart attacks. And we see heart attacks these days at younger ages, at least 1 to 2 decades earlier. Previously, about 30-40 years back, heart attack was a disease of the elderly. It would come after 60s, 70s, but now you see very frequently heart attack coming between 30 and 40. I must have seen at least 4 patients of young heart attack today in Pulwama. We have a center in Pulwama, beyond Pulwama, so patients come there and you see so many of them. And worse is that if the heart attack is not treated properly, they come with heart failure, bad hearts, and which has a very high mortality. And it's not recognized very well, and the treatment is inadequate. So those are something. So it starts as a bad lifestyle, gives rise to some irreversible changes in the risk factors, and get into problems and die early or become incapacitated at an early age, at an age when you are the sole member of the family looking after a family.
That's, I think, because of the physical activity. Like women earlier used to work in the paddy fields, but now we have switched to a sedentary lifestyle. Yeah,
you can see obesity. Obesity has become a major problem in all over the world. But I see in Kashmir it's out of proportion. In ladies, ladies who would be working in the fields, they have, financially better off now. So they employ laborers from outside Kashmir. They can afford it, tractors, which is good in a way. But at the same time, that physical activity is not there. Previously, I remember in my childhood in Hall, my aunts used to go with a, pitcher on their shoulder and go to the rivulet and get, or to the spring to get, clean drinking water. It will be at least, half a mile of walking, going, coming back, climbing 4 or 5 of stairs. That's no longer there. There are taps in every
Every household now.
kitchen, everything, which is good.
Yes.
But at the same time, that exercise component is gone.
Yes.
And people have to realize that physical activity is very important. It may not be necessary for your day-to-day living, but you have to do it, compulsorily. Otherwise, you get obese and you acquire all these risk factors. Yeah.
So you have written an excellent memoir, which I read it yesterday, I think, When the Heart Speaks. It's an excellent and extensive journey of your entire life. What, according to you, is the best part of that autobiography, which you would like to share with us?
It's not an autobiography, it's memoirs.
Memoir, exactly.
All the things, because I don't maintain a diary. But at the same time, the things which struck me the most and which I remembered. And one of the things was my passion for Kashmir.
Yes.
In the beginning,
I also read that you were emotionally very much attached to your mom, and that's why you
connected
couldn't.
to Kashmir, and my journey of becoming a good student started because my father did not allow me to come to Kashmir on one summer because I had not done well in the exam. He said, "You have to stay here.
Okay.
Your younger brother, who was quite younger, 12 years younger to me, he would go to Kashmir. You have to stay here as a punishment." And that punishment really hit me hard. And it became a passion that I will study because I have to go to Kashmir next year.
Okay.
And then, it was fine. And that was one of the very important turning points of my life. And then the medical education, and then how I saw corruption coming into medical field.
Okay.
I saw people in Delhi, some of the hospital owners started giving money for bringing in patients, and that's how it wasn't there. It wasn't there till 70s. It all came in, and it has become a disease all over the world now,
True.
in one form or the other.
Yes.
So how an unethical practice started. When you go for a job as a cardiologist these days, the hospital director asks you how many angioplasty would you be doing in a month because that is revenue for them. You would say,
They maintain a sort of a target to fulfill.
target, and they would give a number which is not achievable. 60, sir. He said, okay. When for the first 10 days, 15 days, he doesn't get any patient, then he starts performing angioplasty in those patients, but it is not required, but it is not necessary. And that's how, this is malpractice, isn't it? And that's not good for the patient, and, unnecessary stents, unnecessary treatment. So that I have seen with my, eyes. And then another chapter was that when I traveled abroad, I traveled extensively during my early part of my cardiology career in the first 10-20 years, giving lectures, going for, learning procedures which had started earlier in Europe and United States, and then meeting people there, and also, seeing in England the discrimination which, people from outside England, people from India, people from Southeast Asia, South Asia were getting. And this was quite visible there. And not during the professional periods, not during the hospitals, but when you go out. And I remember once I was going to airport early in the morning with my bag, and there was some ruffian sitting there, and then say, "Hey, Blackie, where are you going?" And I thought, I'm not so black, but at the same time, I'm brown. Okay. And they chased me, and a great difficulty I could enter the train, otherwise they would have, hit me hard. And they said, "Whatever money you have in the pocket, please hand it over."
Okay.
So that was the kind of discrimination which was ugly that I saw. And then I also met some taxi drivers who were from India or Pakistan. They would engage you into long stories, gossips about their own country. One was from Lahore. He talked about Lahore. I talked about Kashmir. And
so you got to explore them.
and how they had come to America, all the way from Lahore, and now how well settled they are. And some of them were, very well studied, engineers and all that, but they came out, they didn't have a job, and they got a cab driver, and then they made a living out of it, and the children were very well studied. So you come to know, and you met all kinds of people, and that's what some of the chapters in my book are around that. I went to Pakistan, I went to China, and I gave lectures there, and you could see that when you go to Pakistan, people there, are so very affectionate, and it's not the kind of relationship which politicians have built for us. And visiting almost all parts, I went to Muzaffarabad, Azad Kashmir, what they call.
Yes.
And from there, you could see the passion people of that place had to come to.
So you've got a lot to explore. So now that you have worked on a local ground, you have met a lot of people, you have got to interact with them, you have done a lot of community outreach work, you have left some legacies as well. Because as I mentioned, you were very much attached to your mother. I have also read in this memoir that you have created a foundation after her name, which is the Gauri Heart Foundation. Please tell us something about it.
Yeah, we have created a foundation called the Gauri Kaul Foundation, and that basically is the mission is to spread the message how to prevent a heart attack, how to not get diabetes, hypertension, or if you get it, how best to treat it, and also to spread the good medical care to peripheral parts. And that's the reason we have started a center which is about 6 kilometers beyond Pulwama on the road to Shopian. And that is in a village which is my ancestral village. Hall.
Yes.
And that village, gives a ghost appearance these days, because that was one of the rare Pandit villages.
Yes.
And most of them had to go for reasons, everybody knows in 1990 there was a turmoil here. And except for one family, there is no Kashmiri Pandit there. So I decided to make a center there on the name of my grandfather. Prasad Ju Khan. We're basically Khans. Our surname is Khan because probably my great-grandfather was working for Pathans.
I have also heard that your grandfather, in my memory, had a provisional store there, a departmental store.
Yes. A big store.
Yes.
Which housed everything.
Yes.
From cloth, wholesale tea, hardware, books, Zachwar, and medicines, Unani medicines, and everything was there, and that had become one of the biggest stores of that place. It was like a supermarket, and people from all the many small shops from Pulwama district, Shopian district, Kulgam district would come and buy from there. And that building is still there, and it gives you all the, once you got nostalgic memories of that era. Yes, that store was there. Until 1990, it was doing very well. Yes.
So we in Kashmir have seen a lot of myths and facts regarding heart attacks. Some people, I have personally heard some people saying that eating a lot of dry fruits or having a lot of nuts leads to heart attacks. Somebody says that screen time, these have radiations. What's your take on that, and how do you see these myths versus facts?
See, the myths about the heart attack is that if you get a heart attack, you are going to die. With a good treatment, not more than 5 to 6% of people die of a heart attack. That is a myth.
Yes.
You need to recognize it early. First of all is how to prevent it. That we talked about. But once you get it, as early as possible, you seek medical attention. And the fatalities are very low, and you can lead a normal life after that. The facts are that, it has multiple risk factors. You need to prevent those risk factors, seek an early treatment for that, and don't stop the medical treatment. If you feel that 1 year has passed away and I'm fine, no, that's extremely important. And also some of the things like, healthy lifestyle, which we talked about earlier, has to be very, very important and inducted into your life. And some of the heart patients become role models for people for not getting a heart attack. Spread messages
survivors.
that I have got a heart attack at a young age, but others should not get it. So spreading the message why he got a heart attack, how he survived a heart attack, and what you should do for not getting a heart attack. So those are some of the facts about a heart attack, and heart attack these days is eminently treatable as long as you seek early medical attention, and don't allow your heart to become bad. Heart failure, if you don't treat your heart attack properly, it leads to heart failure, and heart failure has a very bad.
You had also written an article in the Greater Kashmir, like heart warnings.
That's
I read that, yes.
Yeah, and then this in this cold weather, you should observe some kind of precautions, that you should get a complete medical checkup done, because hypertensives have a tendency to increase their blood pressure, physical activities decrease, so cholesterol levels increase, diabetics, their diabetes becomes out of control. So it's extremely important to have a routine evaluation at the start of the winter season. This is the time, maybe, and now the winter has actually come in. And possibly modify your medication under supervision, and also make sure that you do not gain weight. You maintain your weight, and don't expose yourself to chill, because that leads to vasoconstriction, and people who have high risk for getting it can get into a problem. Don't do extensive, extreme exertion like shoveling of snow and all that yourself. Allow people who are much younger than you, don't have risk factors, to do it, or do it during the daytime, not very early in the mornings. So these are some of the things which one has to observe in the winter, and winter does lead to higher incidence of heart attack because of all the risk factors increase. That's important.
So what will be your advice to the young upcoming cardiologists?
A young upcoming cardiologist, number one, should be ambitious but should not be greedy. Number two, they should have, not take things for granted. They should be, questioning all the new things which come. Everything new doesn't mean it's good. So you should introspect and see whether this new technology or new medication is adding something to it. And also keep in touch with the literature. These days, the literature keeps on getting added. You go on getting new things. So once you have become a cardiologist, don't think that the story is over. So continue to study. And also, heart is a complicated organ. So look after your patients very well with empathy. You just don't stop by prescribing 4 drugs and ask the patient to go away. Explain to the person what is the importance of this medical treatment and why he should not give it up, and how follow-ups are very, very important. And also impart this knowledge to the public by joining some public programs, educating the public, educating the masses that if you get any chest pain, should not ignore it. And get an ECG done as soon as possible. Don't ignore it. Don't delay it by a day or so. And so those are some of the very important things. And always be very compassionate to the patients, because patient is coming to see you to seek your advice. Give him your best possible advice. Don't be in a rush to treat him. Spend some time with him, and always ask for a good follow-up.
So my last question to you would be, how evolved do you see the field of cardiology in next 5 years?
I think cardiology, like all other fields, is developing rapidly. Artificial intelligence, which we talk about these days, is very important and has come into the field of cardiology also. The robotics have come into cardiology. You can perform some of the procedures not actually going to the hospital, sitting at a center, and you can do these by giving robotic compounds, commands. And also you can see that the medical treatment by artificial intelligence, you can specially create a algorithm for the patient's treatment. Every patient for high blood pressure doesn't require the same kind of medication. By artificial intelligence, it will be told that if this person has this particular risk factor, and if this person has, this kind of a family history, and these are the investigations, AI gives you what is his chance of getting a fatal event or a serious event needing hospitalization, and what are the possibilities of reducing it. So I think use of these technologies is very good. Proper dosage of medicines and follow-up also by artificial intelligence. You don't have to bring the patient every 6 weeks or every 1 month or every 2 weeks. These are the new methods which you can use for follow-up. So I think the future is bright. New technologies are coming, and these new technologies all have built-in artificial intelligence into it, and you can always improve upon your treatment and never be shy of if you have committed a mistake in your treatment and you realize it, never be shy on correcting it, and you don't defend yourself. You can always say that this was not proper and this has to be done, and always treat your patient as one of your blood relations. Yeah.
Thank you so much, sir. It's my pleasure to have you here. Thank you for giving GK Podcast some of your time.
Enjoyed the questions and answers.
Thank you so much.